Good afternoon, everybody. As Donna mentioned, I am Julie McMurray with the Alzheimer's Association, and I am so thrilled to be here this afternoon. So I want to mention to you that our main office is in Watertown, Massachusetts, and we have regional offices in Worcester, Springfield, Raynham, Bedford, New Hampshire, and Lebanon, New Hampshire. We are part of the National Alzheimer's Association, which is based out of Chicago, and in every single state there are chapters. So we want families to know that, Alzheimer's disease, it is a progressive disease. People can live 8 to 10 years on average, but we want families to know that we are with you throughout this disease process. I always tell the families that I work with that I want to be out of a job. Honestly, I have been in this field for almost 20 years. I've worked with the Alzheimer's Association for 10 years. I want to shut my door. That would mean that there was a means of prevention or a cure. Until that time, the Alzheimer's Association is here. Our mission really is to enhance care and support for people living with disease, their families, their caregivers. We also are the largest funder of research. And we also try to educate individuals on ways to reduce your risk for developing Alzheimer's disease. A lot of what we do and a lot of what I do on a daily basis is provide outreach and education, both to family members and individuals living with the disease, as well as training professionals that are working in our community-based organizations, our long-term care facilities, and our assisted living facilities. We also do a lot of advocacy work, both nationally as well as locally. We want to make sure that services that are provided to individuals living with the disease are at top quality. So we, storm the State House every year in Boston, and we also send a contingent down to our capital. I was lucky enough this past year to be one of 700 advocates that stormed Capitol Hill and talked to all of our senators and our congressmen on making Alzheimer's a priority. So as I mentioned, we have a 24-hour, 7-day-a-week helpline that is accessible. No question is silly. Sometimes you just need a supportive ear to get you through a frustrating moment. We are here for that. The other thing we often find is families need someone to help navigate all the community resources. So if you call our helpline, we can connect you to the community resource that would help you. We also provide referrals to various local agencies, whether it's an assisted living facility, an elder law attorney, an adult day health center, a nursing home. We want to make sure that our families that are dealing with Alzheimer's disease are educated and have the information and the tools to make great decisions for their loved ones and for themselves. As a result of our helpline, we found that families were calling us, and we realized that they needed really more than what they were asking for. So one of the things that we developed about 6 years ago was our care consultation program. That is an opportunity for families to sit down, or we can also do it over the phone or through email, the opportunity to tell your story. We listen to your story, and then we develop an action plan based on the needs that you may have. It would be very easy for me as a care consultant to say, call this person or call that person. We try to give you options and the tools on what to look for in the different services. Just power, and I think with Alzheimer's disease, you have to be proactive rather than reactive. And sitting down and having a care consultation is a way that you can have the information, whether you need it right now, 6 months from now, or 3 years from now. As Joanne mentioned earlier, she has been a huge mentor of mine, so I was thrilled to see her here today. But we have support groups. Actually, we have over 150 support groups. That is the wrong number. that are accessible to families. We have them throughout Massachusetts and New Hampshire. We want to make sure that families who are feeling isolated get connected, and that they have the opportunity to connect with other individuals that are going through a similar situation. If you call that helpline, we can connect you to a support group in your area. Support groups are vital for caregivers. Not only do we have them for caregivers, but we also have them for people in the early stages of the disease, which I think is very powerful for individuals that are living in the early stages to connect with other people also going through a very similar situation. A lot of what we do is education, and some of the programs that we offer in the community is a program called Getting Started. It's a very thorough overview of what Alzheimer's disease is and the different topics that you need to really be aware of. Getting a diagnosis, understanding some of the legal aspects. I'm not an attorney, I always refer to an elder law attorney, but we want to make sure people are aware of the importance of addressing legal and financial issues. We also cover communication strategies, understanding behaviors, and community resources. Other programs that we offer are our legal and financial program. It's when an elder law attorney actually comes out and provides their expertise on the importance of addressing elder legal and financial issues. We have a program called The Basics of Alzheimer's Disease, what it is, what it's not. We also have a program for people that are newly diagnosed or maybe aren't even diagnosed but are concerned about their memory, called Coping with Early Memory. And it really goes over some lifestyle strategies and things to be aware of down the road. We have a program called Know the 10 Warning Signs that really helps to identify what those warning signs of Alzheimer's are, how it is different from normal aging, and again, the importance of when you start noticing some signs to please go and have a talk with your primary care physician. We do a lot of research events. As I mentioned, we are the largest funder of research. We want to put an end to this disease, and so we advocate ferociously with that. And we also do conferences throughout Massachusetts, and they're partnership conferences, and it's a group of individuals coming together that work in the field that want to create awareness. But what we do for families is free of charge. We are a nonprofit organization. We do not want families and caregivers and individuals living with the disease to feel that they are alone. We want you to connect with us throughout this journey. We also do a lot of professional trainings. We have a program, Caring for People with Alzheimer's, a habilitation training curriculum. As both Linda and Joanne mentioned, habilitation, a person's approach to care is so important. The importance that emotion is always with them and how to go about promoting a positive interaction. It's really important. It's an 8-hour training we do for staff. We do a foundation of Alzheimer's care, looking at medications, bathing, all the different personal care issues. And again, these are all trainings we provide to professionals. We also do support group leaders training so that our volunteers that are support group leaders have the tools that are necessary for facilitating a support group in the community. Our largest professional conference is Map Through the Maze, which we have over 600 professionals come to Marlborough, Massachusetts every year and listen to the current topics in the field of Alzheimer's disease, and they can bring it back to their agency or facility. Again, we do partnership conferences and ongoing in-services. I will often go to a facility and do an in-service specific to a topic that the nursing home or assisted living is looking to offer to their staff. Linda mentioned the Safe Return Program. Our Safe Return Program is really a safety net for individuals who have Alzheimer's disease or another form of dementia that are at risk for wandering. We want to make sure that People who are at risk for wandering are registered in this program. The Safe Return Program is a nationwide program. It works in Massachusetts, Rhode Island, Florida, Alaska. And what happens is when you register your loved one, and they get lost, we make sure we act as liaisons for emergency response teams, the police, to make sure that they are aware that this individual is lost, and we make sure that the family doesn't have to worry about making all those phone calls, that we will do that for them. The individual enrolled in the program gets a bracelet with an identification number and saying that they have Alzheimer's disease. It alerts somebody. The other nice thing about this program is that caregivers can also get a bracelet saying that they are a caregiver, so if something happens to them, it would make the person who finds them, or if they fall at the grocery store, they can alert emergency personnel that they are a caregiver for somebody with Alzheimer's. Again, we are the largest private funder of research. We have information at our booth on our trial match program. You know, it's really important that we have bodies to advance research. So there's information on how you can become involved in a clinical trial. It's not just for people with Alzheimer's, but it's also for healthy people and caregivers. And it's a wonderful program, again, to really help put an end to this disease. As I mentioned, we do a lot of public policy and advocacy work, both on the state level and on the national level. We want to make sure that people that are living with this disease has access to the best care possible. We recently passed into law minimum requirements for Alzheimer's care units in nursing homes to make sure that the staff are trained appropriately and that there are minimum standards. And nationally, President Obama just in the last 6 months signed into act the National Alzheimer's Project Act, and his commitment is that an additional $156 million will go to care and support and research for people living with this disease. We do a lot of public awareness events. Some of you may be familiar with our Walk to End Alzheimer's. It is our largest public awareness and fundraising effort. We have raised over $2.3 million just in our Massachusetts, New Hampshire chapter. Our walk locally is at Quinsigamond Community College the last weekend of September. I am very pleased to report that we raised over $295,000 to support our efforts locally and to really, again, move this mission forward. I want to be out of a job. We also do a memory ride every summer. We have a Run for a Cure in our Boston Marathon. We have a team every year, as well as Make the Link golf tournament that we have in the summer. But again, everything we do for families is free of charge, and we are able to do that through our fundraising efforts. I just want to say thank you so much. I know that's really a quick overview, but again, the most important number that I want to leave you here with today is our 24-hour, 7-day-a-week helpline. I think it's a very valuable phone number whenever you need someone to talk to, or you're searching out a community resource. Thank you so much.